Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. The Centers for Disease Control and Prevention estimates that 1.6 to 3.8 million sports and recreation-related concussions occur each year in the U.S., and 10% of all contact sport athletes sustain concussions yearly. What exactly is a concussion? How is it treated? How do you prevent a concussion if you play in a contact sport? We'll get the answers to those questions and more as we're talking with Dr. Javier Cardenas, Director of the Concussion and Brain Injury Center at the WVU Rockefeller Neuroscience Institute. Welcome, Dr. Cardenas, to Tuesday Talks.
Thank you. It's a pleasure to be here.
It's great having you here. If you have any concussion-related questions, just enter them in the comments section below and we'll try to answer them live. Okay, that's a lot of concussions, isn't it?
There are.
We were talking about in the intro.
It keeps us busy, that's for sure.
I'm sure it does. So let's start with exactly what is a concussion.
Absolutely. So a concussion is the mildest form of a traumatic brain injury. Now, in order to have a traumatic brain injury, you have to have a change in the brain's function as a result of trauma. So, let's use a car accident as an example. If there is that change in brain function, loss of consciousness, the most obvious one, although the patient will never know that because they don't remember that. Amnesia, the most common.
Really?
But you can have confusion, you can see stars, you can feel like your bell is rung, feel dizzy, have a headache at the time of the impact that would indicate a change in brain function and therefore a traumatic brain injury. Now what's special about concussions is that it is an injury to the brain's function that does not represent any damage to the brain tissue.
Oh.
So, now, I know that perhaps this isn't the right place to say this, meaning geographically, but I often describe it as kind of like earthquakes. So you have these gigantic earthquakes, Morocco for example, buildings are destroyed, damage is permanent, that's severe.
Yeah.
But then there are some less severe earthquakes that may knock books off shelves, they make a huge mess, but there's no permanent damage. That's kind of like what a concussion is. And what's happening in the brain is there's this spilling of all these neurotransmitters as a result of the trauma, and then your brain has to clean it all up. And during that time, your brain is recovering from the injury.
Wow. That's a good analogy, though. I like that. So it's one of the, maybe like a 2 or 3 on the Richter scale, right?
Exactly.
Okay.
It is. That would be a good description.
So what is the most common cause of concussion?
Now, it's fall, so we're thinking, well, it's sports. Actually, not the case. It used to be motor vehicle crashes were the #1 cause of concussion, but we have airbags and seat belts and crumple zones and stability control. So now the #1 cause of concussion is falls.
Falling down.
Indeed. And in fact, this number is rising because as our population ages, we see more falls and we see more people trip over things, including pets, fall and hit one's head and cause a traumatic brain injury, a concussion.
Wow. Well, that makes sense as we're getting older here. Not all of us, right? So what are the symptoms of concussion?
So the symptoms or the consequences of concussions fall into 3 broad categories. There are the physical symptoms, the behavioral symptoms, and the cognitive ones. So by far the #1 symptom falls into the physical category, and that's headache. Second most common is dizziness or imbalance. People can also have a change in sleep. Initially they tend to be incredibly sleepy, and then on the extreme side of traumatic brain injury they can even be in a coma. Then there are the mood symptoms. The most common is irritability, but people can be anxious and they can be depressed as a direct result of the injury. And this can be disturbing to the family, especially a young person who might play sports and then they see this behavioral change in their child. The last is cognitive, also incredibly relevant for our student population. The most common is trouble with focus. You can also have trouble with short-term memory, calculations, finding the words that you want to say. Now, the fortunate thing is these things tend to be their worst within the first few days. And then they tend to get better day by day, week by week, and for some people, month by month.
Oh, okay. So it can be faster or slower. As far as treatment, has it changed? Because I remember when, like, if they thought you had a concussion, it was like, don't let them sleep. Is that still a thing? Didn't that change?
It has changed.
Okay.
Now, when you and I were playing sports,
Okay. Wow.
we got that pat on the butt and went right back on the field.
Yeah.
Right?
Yeah.
That was wrong. We know that was wrong. We know that was dangerous. And then the pendulum swung. For a while, collectively as physicians, we would tell parents and we would tell kids, if you get a concussion, don't do anything. Don't look at a screen. Don't do any physical activity. Go into a cold, dark room until you're better. That's also wrong.
Oh, wow.
And part of that is what we've learned from the broader traumatic brain injury experience. We have people who are in the intensive care unit who don't have part of their skulls who are getting physical therapy.
Wow.
We have people who are being rehabilitated in that severe state. Now applying that to a concussion, what we tell people is the most important thing is that you don't put yourself in a position to hit your head again. Because in rare circumstances, you can have bleeding of the brain, swelling of the brain, which can lead to death and disability, which is scary. It is super scary.
Yeah.
Fortunately, it's rare, but it happens in this country every single year.
Oh, boy.
More commonly, if they hit their head again, then they can have worsening of symptoms and then an even longer recovery.
Wow.
But the good thing is they can do physical activity, avoiding head contact, can do academic activity, can do social activity. In fact, we found that exercise and these activities are actually therapeutic to the brain in terms of their recovery.
So we've kind of found a middle ground between those two extremes of don't do anything or, hey, go get back in the game.
Absolutely. And then there are even more specific treatments. So for people who have headaches, there are medicines that can treat them, especially if you have a history of migraine. There are balance therapies that can be done. There are vision therapies that can be done. And there are even cognitive therapies that can be done. Now, these can be applied to somebody who suffered from a severe injury or even from a concussion, and it can accelerate and have a complete recovery.
Oh, wow. So there's some hope there, right?
Very much so.
Okay. Since we're talking about this for treatment, after you have a concussion, can you tell me a little bit about post-concussive symptoms? Because you mentioned that, for some people it will be better in a few days or a few weeks, but for some it could be a few months or longer. Are there many cases where after having a concussion there are still lingering effects?
Absolutely. So there is a small percentage of people that will go on to have persistent symptoms as a result of concussion. When we are evaluating somebody who has a prolonged recovery, or they have symptoms that get worse, or they have this up and down recovery, then we do ask several questions. The first question that we ask is, was their injury worse than a concussion? Meaning, is there any evidence in imaging of the brain that shows there may have been damage, even minor damage? The second question that we ask, is there a new physical symptom as a result of this injury, such as new post-concussive headaches, new post-concussive migraines? Third question, is there an emotional component to the recovery, meaning did they develop some anxiety or depression as a result of the injury? And last, which is incredibly common, did the injury worsen something that was already there? So for people who have a history of migraines, they most often have more headaches and migraines. For people who have a history of anxiety and depression, it can be worse. For people who, especially students who have ADHD, their ADHD goes through the roof. So that's the way that we approach it in order to find out what is the reason, number one, and number two, provide a focused and directed treatment.
Okay, so some of us can have lingering effects. Is there any way to treat these lingering effects?
Absolutely, and we take them in those same categories. On the physical side, we look for ways in which we can treat those headaches, balance, vision problems. On the behavioral side, we look at things like therapeutic medications, therapeutic counseling. All these things are important. And then on the cognitive side, we look at cognitive testing. We look at therapeutic interventions with occupational or speech therapy.
I know I kind of jumped ahead on this, but I wanted to back up on what are, we talked about symptoms of post-concussive symptoms, but what about just regular concussion symptoms? Because I know my son had a concussion several years ago, sled riding, but he didn't have headaches, he wasn't nauseous, his pupils weren't dilated, but boy, did he have the short-term memory loss, and it was scary, but it sounds like every concussion is different. You don't have to have all the symptoms.
Absolutely. The saying in the brain injury world, if you've seen one brain injury, you've seen one brain injury. And part of that is because those symptoms that we've described as being long can be most often in the short term. And they tend to be more abundant in the short term. And so, in fact, your son is a bit of an exception in that he had a very focused presentation with amnesia. But it's not entirely common. And in fact, it's really important to note because there are tests that we have after somebody has a concussion, but they might only test one modality. They might only test the cognitive areas, like with your son's experience, or they might only test vision. And so some people have isolated vision problems. They might only test balance. And so having a multimodal approach or a multifactorial approach is really the best thing to do when you see somebody who's sustained a concussion.
So if you think you've sustained a concussion, should you go to the emergency department?
It really depends. So immediately after the injury, if you are having really bad headaches that are worsening, or if you see somebody who has a head injury and they have a seizure, they start vomiting, they have a declining level of consciousness, meaning they're getting sleepier and sleepier, then yes, those are what we consider the red flags.
Okay.
They need to go to the emergency room. Now, once in the emergency room, please don't ask for a CT scan. And the reason is, whoever is evaluating the patient will determine if a CT scan is necessary. People will think, oh, well, I need to go and get a CT scan, and that may be necessary, but it's really important to let the physician who's in the ER decide. And the reason is, there's radiation that comes with it. So it's not risk-free. We want to make sure that people understand what the reason is. And really, in that situation, you're looking for big, bad, and scary. You're looking for a skull fracture. You're looking for a bleed. You're looking for swelling of the brain, something that you need to address at that moment. And if that's not present, then you don't need to worry about it.
Don't put yourself at unnecessary risk, right?
Absolutely.
Okay, so how do you prevent a concussion, especially if you play in a contact sport?
Yeah, so talking about sports, there are different risks depending on the sport. So at the top we would put our combat sports. So these would be things like boxing and mixed martial arts. I know we cringe, but these are athletes and we still want to make sure we take care of them. Believe it or not, they are worried about their brains and brain health and long-term activities. Then there are the collision sports. So these are things like football, ice hockey, men's lacrosse actually falls into the category of collision sports. And then there are the contact sports. So this is where we have soccer, where we have basketball, where we have baseball, and then finally the non-contact sports such as tennis, pickleball, and things like golf. Now, can you sustain a concussion in any of those sports? Absolutely you can. But clearly the risk is higher with the higher level of head contact, such as combat or collision sports.
Yeah. So if you're playing in a contact or collision sport, how many concussions are too many? In fact, when my son was in high school, like 10 years ago, they had a 3-and-out rule. I don't know, that seemed like a bit generous to me.
It is, and part of the idea behind this 3-and-out rule was there was old literature that said if you had 3 concussions, then you are more likely to have a decline in your performance on cognitive testing. There are a couple issues with that. One is it was a very strict definition of loss of consciousness with each of those. Our definition of concussion has changed, and it's changed for good reason. Meaning we don't want people to put their brains at any risk. So now, if you see an athlete and they bump their head and something is off, they are diagnosed with a concussion, which is completely appropriate at the time because you don't want them to suffer any greater injury. Now, on the flip side of that, we see people sustaining more concussions because we are calling things that we didn't used to call concussions, now we call them concussions. Once again, that's perfectly fine. We're very thoughtful. Now, for that reason, there's not a magic number when it comes to concussions.
Okay.
But when somebody suffers multiple concussions, it is appropriate to consider an evaluation, especially if you're worried about their long-term brain health. Sometimes that evaluation involves imaging of the brain, looking to see if there are any changes related to trauma. Some of that evaluation includes cognitive or thinking testing. And these tools can be used in the future so that if there is a concern on the part of the patient, then they can go back, repeat the testing and say, actually, you're actually pretty good compared to where you were. Or, you know what, we do see a decline and we need to be more vigilant about how we approach your future care.
So we were talking before the show about the importance of baseline concussion testing for this reason, right? I mean, you have something to compare it to. You were telling me that now this is going to be offered to, well, if it isn't already, I'll let you finish.
Absolutely. So at the Rockefeller Neuroscience Institute, we are offering free baseline testing to every single high school athlete in the state of West Virginia.
Wow.
Now, this is what we call the Rockefeller Concussion Network. Now, there are a few important caveats. One is it has to be a secondary school athlete, so a high school athlete.
Okay.
And their school has to have an athletic trainer. You may ask, why are we emphasizing that point? Athletic trainers, first, they keep your kids safe.
Yeah,
They prevent injury. Second, in all professions, athletic trainers are the best equipped to deal with concussion, especially when it happens on the field. And then finally, they help our kids get back to a healthy state. So when it comes to that baseline testing, it is valuable because we can have a comparison, but it's also important to recognize what it cannot do. It cannot diagnose a concussion. It can identify when there are changes related to concussion. It can help you in that, but it is not a diagnostic tool in and of itself. And just like a lot of things in medicine, it is just one tool.
Okay.
So there might be some abnormalities that might be related to concussion, they might not be. And that's where interpretation comes in. Whether it's a neuropsychologist or if it's a physician who's looking at the testing, it's important to know what the test means and the results mean.
So you would recommend, though, a baseline concussion test?
When it's available, and that actually is a reason why we're offering it, is because we believe it adds value. It's also important that it's administered properly, because the only thing that's worse than not having a baseline testing is having an invalid baseline test.
Yeah.
Meaning something that doesn't provide value. And they're actually, within computerized baseline testing, there are measures to see if it's valid or invalid, and so they tend to be flagged. And if indeed they're flagged, we want to make sure that it's repeated so that we can get a proper baseline test.
Good to know. Good to know. That's a really cool program. I wanted to ask you, do most people that get a concussion, do most of them fully recover?
They do. They do. There's a small minority that will continue to have symptoms, in which case we will further evaluate them for the reason for that persistence of symptoms. And more importantly, try to help them get better, because that's, at the end of the day, that's really what they want.
Okay. Now, I mentioned at the top of the show that you are the director of the Concussion and Brain Injury Center at the WVU Rockefeller Neuroscience Institute. Can you talk about the level of expertise of the team at the Concussion and Brain Injury Center?
I couldn't be happier to be here.
Aww.
And the reason is we have an incredible team. So our program is a comprehensive program focused on the patient in the middle. Now, we've talked a lot about sports, clearly, but it's not just sports. There could be motor vehicle crashes, could be falls, could be work injuries, domestic violence, which is a really important program, and even first responders. So we try to address those same categories. On the physical side, we have neurologists who can address the physical consequences of traumatic brain injury. We have a psychiatrist who's part of our program to address the emotional changes, a neuropsychologist who can address the cognitive deficits, the thinking deficits, as well as actually cross over with some of those mood changes. And then a team of therapists, physical vestibular therapists addressing the balance issues, a vision therapist. There's a whole department of speech cognitive therapists and occupational therapists who help with the day-to-day needs and the return. Now, all of this happens at the Rockefeller Neuroscience Institute, and believe it or not, we're expanding and growing. And while we are focused on physically being in Morgantown, this is something that we are offering to the entirety of the state.
Wow.
We're going to be able to capitalize on the skill set of telemedicine, on the WVU network, a hospital network throughout the state. So we're really excited and about the care that we can provide.
That's great. That's a huge team, too. You're covering all your bases.
It is a team, and that's just on the outpatient side. Inside the hospital, we are partnered with our emergency room physicians, our sports medicine physicians. We have incredible neurosurgeons, trauma specialists. There's a new physical medicine and rehabilitation physician who's coming to establish some inpatient neurological rehabilitation.
Great.
Fantastic work that we're really excited to be a part of.
This is an exciting time.
It's a great time.
Here at the Rockefeller Neuroscience Institute. It's always exciting, right?
Yes, it is. Yes, it is.
So before we go, I always like to ask you, what's the most important thing you want our viewers to know about concussion?
Well, you asked me a question earlier about prevention. And I skirted that question a little bit because we were talking about a few other things. But one of them, of course, is protection, helmets. Okay, so the short answer to the question is, when should I wear a helmet? If you're moving faster than you can run, you should be wearing a helmet. So if you are skiing, if you are snowboarding, if you are bicycling, if you are skateboarding, that's the time to wear a helmet. Now, what are some of the other things? Some of it's common sense, following the rules, whether it's on the field, right? Good sportsman like activity, whether it's stopping at the stop signs, not running red lights, resulting in motor vehicle crashes. Those are the things that can prevent injuries. Now, what I'm also really happy to announce as part of our program is the community program. So we heard a little bit about the youth program. So this is the Rockefeller Concussion Network, which offers our baseline testing, works with our athletic trainers. We also have a domestic violence program where we are focusing on identifying brain injury and domestic violence survivors. And then finally, a first responder program. First responders are at an increased risk of concussion and brain injury. We want to make sure that we provide them a special pathway, identifying a baseline process, identifying a field evaluation, and then a pathway so that we can provide treatment and return to duty processes.
So you're reaching out on all levels here.
That's the idea.
You've only been here a few months. You have hit the ground running.
That's the goal. We do have a lot of work to do, but it's valuable work and it's meaningful.
Well, we certainly appreciate you being here and sharing all this information with us. And thank you for that. We appreciate it.
My pleasure, and it's an honor to be here. Thank you.
All right, thank you. That brings us to the end of this edition of Tuesday Talks. If you're looking for more information about concussions, visit rni.wvumedicine.org/concussion. And join us on the next Tuesday Talks on September 19th, when we'll talk about suicide prevention with Jamie Brandish, a licensed psychologist at the Rockefeller Neuroscience Institute. I'm Mary Ravazio Menard, and on behalf of Dr. Cardenas and everyone at WVU Medicine, thanks for joining us and have a great day.